So in this video we are going to talk about cervical spine instability test or in clearing test to check for any instability in the cervical spine. Now, why it is important for a physical therapist to know cervical spine instability, especially when a physical therapist is performing end range mobilization and or manipulation in the cervical spine, and specifically in the upper cervical spine. It is very important to know whether a patient has any unstable cervical spine or not. Now, what are the causes for instability? It all starts with the ligament first. If the patient has damage in the ligaments like the transverse ligament or the Alar ligament, or it can be a muscle weakness if the patient has a weakness in deep neck flexors or the extensors of the cervical spine. It can be due to a bone or joint damage. It can be due to a rheumatoid arthritis, osteoporosis, congenital malformation, Down syndrome, or even sometimes long-term usage of corticosteroid usage. And it can be due to any arthritic condition. Now, what are the signs and symptoms for cervical spine instability? If the patient has cervical spine instability, first of all, patient has a severe muscle spasm. Second, severe headache with any mobility in a cervical spine. Facial and lip paresthesia, nystagmus, dizziness, pupil changes, nausea, vomiting. And so we'll start with the 4 tests, starting with the anterior shear test or anterior sagittal stress test. Now in that test, patient is in a supine lying position. Now examiner puts the anterior vertebral force in PACV. It's posterior anterior central vertebral pressure. It starts from the lamina or the transverse process of C1 from all the way atlas. An examiner can perform from all the way C2 to T1 transverse process. Now, why you are checking that? Why you are giving a posterior anterior mobilization? So the end feel is soft tissue end feel with the abrupt tissue stop, abrupt stop. Now you can check from all the levels from upper to lower cervical spine up to T1 transverse process or T1 spinous process, and check if the patient has any instability. How you check? The signs and symptoms of instability are pupil changes, facial and lip paresthesia, lump in the throat, pupil changes, nausea and vomiting, and even nystagmus. Now we'll move to the second test, that is the lateral flexion stress test or Alar ligament stress test. In Latin language, Alar means the wings. So now you check that Alar ligament. So patient is in a supine lying position. Examiner hold the C2 transverse process of second cervical vertebra, and examiner takes the head into lateral flexion. So minimal side flexion is available with the abrupt tissue stop. If the patient can do more, that means that side is unstable. Third test will move to the lateral shear test or a transverse shear test. This test is mainly examining the atlantoaxial articulation or in case of odontoid dysplasia. In that, the examiner places the radial side of the second metacarpal MCP joint on the transverse process of atlas and the second hand on the same MCP joints, metacarpophalangeal joint of the second on the transverse process of axis, and apply the shear force. It can done from all the way C2 to C7. Limited motion is available with no cord and vascular symptoms, and make sure you check the transverse shear forces and check that if the patient has any instability or not. This test is painful when doing examination, so make the patient aware that this test is going to be more painful. The fourth test we are going to talk today is about the rotational stress test or the rotational Alar ligament stress test. In that, the patient is in a sitting position. Examiner grasps the spinous process of C2 by index finger and thumb and rotates the patient's head into the other side, left and right. Start with the no side symptoms first. If an examiner can take the head rotation up to 20 to 30 degree of rotation without moving that second cervical vertebra or the axis, that means patient has instability in the Alar ligament or the transverse ligament. Now, Kale advocated by doing the same test in a different pattern, like patient is in a sitting position and patient's head is rested on the examiner's side, where with the one hand, by the two fingers, you stabilize the transverse process of the second cervical vertebra and pull it backward and downward, and by the upper hand you stabilizes the transverse process of the atlas and the mastoid process and take the head into rotation by upward lifting, and check at the different angulation which side the rotation, how much the mobility is present. Thank you.